Good morning, everyone. Today I am developing an evidence-based care plan for a 35-year-old female diagnosed with anxiety. She lives in a rural area where mental health services are grossly inadequate. Moreover, I will stipulate some of the benefits and drawbacks of virtual collaboration in the development and execution of this care. Telemedicine has been singled out as one of the key drivers of today's healthcare, improper healthcare, and great outcomes in underserved areas of healthcare. The patient is a 35-year-old female who shows evident signs of anxiety, excessive worrying, restlessness, and inability to concentrate on anything. She lives in a rural area and has poor access to mental health care providers, so the relief is to be provided remotely. Maria, her primary care nurse, works in close cooperation with a psychiatrist, therapist, and social worker in identifying an individualized therapy plan for her. Based on the psychiatrist's advice, the patient will be treated using SSRIs in order to overcome anxiety. In conditions of episodes of acute anxiety are to be treated in the short term, benzodiazepines can be prescribed. In medication management, evidence-based practice will ensure current data and patient requirements are informing treatment regarding the same, as noted by Engel in 2021. It will be continually observed and modified depending on the patient's response to the medication to optimize the therapeutic outcomes and reduce side effects. Subsequently, independent cognitive behavioral therapy will continue through teletherapy, relaxation exercises exposure, and cognitive reconstructing. According to Reese in 2022, cognitive behavioral therapy, is particularly useful in treating anxiety disorders as it results in enhanced symptomatic recovery and better coping strategies. Weekly online appointments will ensure that the patient receives constant encouragement and direction to adopt better coping strategies and lower anxiety. A social worker, therefore, has the responsibility of managing the social and environmental aspects that may cause anxiety in the patient. In their study, Engel in 2021 observed that patient-centered care, including social support, can enhance health outcomes. Education and counseling sessions provided to the patient and her family would focus on the necessity of self-care and stress management as critical aspects of managing anxiety. Further consultations can be made to refine the better care plan for this patient. A nutritionist would advise on dietary practices and facilitate to mental health, while an occupational therapist might do so regarding strategies for dealing with everyday life stressors. Virtual follow-up visits will be conducted regularly to check patients' progress and update her treatment plan whenever necessary. Halim in 2021 tells us that telemedicine capabilities can enable this in follow-ups, ensuring continuity of care. To enhance patient outcomes through remote collaboration and evidence-based care, the Johns Hopkins evidence-based care practice model was applied. This model's PET process, practice question, evidence, and translation, guided the development of care plan. First, the practice question identified the need to provide patient outcomes in a remote setting through collaborative efforts. Then, the evidence phase involved a thorough review of current research on remote patient monitoring, telehealth interventions, and a collaborative care models to determine the most effective strategies. The translation phase focused on integrating these evidence-based interventions into the care plan, which included implementing remote monitoring technologies, establishing clear communication channels among healthcare providers, and providing patients with education and support to enhance self-management. These interventions were chosen based on their proven effectiveness in improving patient outcomes in remote care settings, ensuring that the care plan was both comprehensive and aligned with best practices. This care plan began with an adherence to the evidence-based practice model of using current research, clinical judgment, and patient preferences. These sources are trustworthy because the information is published in scientific journals and the research models are sound. They give a solid background for suggested intercessions, thus guaranteeing efficacy in evidence-based practices. There are numerous advantages of remote collaboration in this scenario. It provides for coordinating various professionals in the healthcare setting for an efficient and effective delivery of services. According to Schott in 2019, collaboration improves the quality of care by combining knowledge and efforts from different fields and roles. These barriers are bridged to ensure that the patient receives specialized care that they would not get under normal circumstances. The virtual format also allows for more frequent and flexible contact between healthcare providers and their patient, thus improving integration and communication. Even with several advantages coming its way, remote collaboration has several challenges that might make it less effective than traditional collaboration. These include communication barriers and technological limitations. Therefore, the following strategies are advised. First, advanced telecommunication platforms that support secure, high-quality video and audio capabilities can improve interaction clarity and reduce misunderstandings. Alodabai and Federico in 2019 indicate that health information technology greatly influences patient safety by improving communication. Second, continuous education and training on effective remote communication modes for health professionals will improve collaboration efficacy. England 2021 taught us that proper training is critical in effectively implementing evidence-based practices. Technical support for patients and providers keep the sessions running smoothly, minimizing disruptions. Halim in 2021 state that facing technological barriers should be one of the essentials during the implementation process of telemedicine. In conclusion, the suggested evidence-based care plan for addressing the needs of the patient with anxiety incorporates medication, cognitive behavioral therapy, and social support. While remote collaboration in the discussed context has some disadvantages, its advantages include the ability to provide accessible, coordinated, and high-quality care. Integrating evidence-based practices principles in the sources used in the plan can enhance the patient's safety and outcomes, and the role of the remote care in today's healthcare can be illustrated. Thank you so much.